I think, Mike, you were just introducing yourself.
All right, apparently far enough away from the speaker. So, Mike Gottlieb, I'm at Rush in Chicago. I'm also division director, and I do a decent number of scoping reviews, so I'm excited to talk about that and share some expertise.
And I personally have no conflicts or disclosures. Dr. Gottlieb does receive some funding from the CDC. But we do want to thank Elizabeth Schoenfield, who did create a version of this talk that she had given with Mike previously, and we did adapt some of the content from her. And then in terms of our learning objectives, by the end of the session, we would like you all to be able to explain appropriate applications of scoping review methodology, to describe the 6 steps of a scoping review, and then to be able to discuss pearls and pitfalls of scoping review. And you'll see this QR code that will also appear at the end of the presentation that has further reading in case you would like to deep dive into this later. Okay, so let's start just talking about the concept of knowledge. So this is a little bit of a fuzzy term, but how do we arrive to knowledge? We do so through the process of evidence synthesis, which is the process of aggregating data from multiple different studies and using it to draw conclusions. However, if you've ever done a literature search, the sheer volume of data out there is just like incredibly overwhelming. PubMed adds daily to 32 million citations, which is insane. And so we need practices for evidence synthesis and existing review articles just to be able to allow us to keep abreast of what's out there and to allow us to know what the gaps are so that we continue advancing our fields. The other thing about knowledge is that it's just not as objective and permanent as we would like to think it is. There's a study in the surgery literature that looked at the half-life of clinical knowledge, and it found that it was actually 45 years, which means that over the course of half a century, 50% of what we think to be true will actually be ultimately proven wrong. So it's important that we continue to perform evidence synthesis so that our understanding of what is true evolves as new data emerges. So that's why we want to talk to you today about the scoping review so that you can have this in your toolbox when it comes to evidence synthesis. And I did some searching, and there were a variable amount of different definitions out there for defining what a scoping review is, but I thought this one was the best. And this is by Colquhoun et al., and they describe a scoping review as a form of knowledge synthesis that addresses an exploratory research question aimed at mapping key concepts, types of evidence, and gaps in research related to a defined area or field by systematically searching, selecting, and synthesizing existing knowledge. And Arksy and O'Malley are the 2 main authors that really have kind of popularized the scoping review and provided recommendations for how to do this in a way that's methodologically robust. And they've described 4 main reasons why somebody might take on a scoping review. One of them is to examine the extent, range, and nature of existing research activity on a given topic. 2 is to determine the value of undertaking a full systematic review, so this can kind of be a stepping stone to then doing the systematic review. 3, to summarize and disseminate research findings. And then 4, to identify gaps in the existing literature. So you probably have heard about various types of reviews, and there's even more than the 3 that are described on the top of the slide, but I'm just going to take a moment to focus on these 3 because these are probably the most common ones that you've seen around. And we'll start with the narrative review, whose goal is to examine recent or current literature on a given topic. And this is really historically the most common and the most influential type of review. But as time went on and the scientific community evolved, it also became apparent that it was also the most subjective and the least transparent. And that's a problem when it comes to generating new knowledge because it introduces the most bias. And so there was really a movement toward taking a more standardized and systematic approach to evidence synthesis. And that's really where systematic and scoping reviews come into play. But their goals are slightly different. So a systematic review is really intended to answer a specific question about a treatment or a practice, versus a scoping review that has a more broad goal. It's intended to identify and map what's out there on a given topic. And while both of them do involve a standardized and systematic approach to doing this, they have some unique features that are important to highlight. A systematic review is more rigid, but because of that has the highest likelihood of generating reproducible results, and it also has the most rigorous interpretation, so involving statistical practices such as meta-analyses, where you can actually aggregate the results from multiple studies. A scoping review, on the other hand, is iterative. That means that it's a little bit more flexible, so you can actually modify your approach as you go, depending on what you find. And you can use it, as I mentioned before, as a stepping stone to a systematic review because it will help you identify the gaps. It also tends to generate a chart or a map, which is a really key feature, so there's this visual element to how the results are presented. And kind of crossing out that narrative review, since we just established that it's essentially garbage, the systematic and the scoping review are the two that we're going to focus on a little bit more and delving into the nuances between how they differ. So for both of these evidence synthesis approaches, they both require an a priori protocol. That means in advance, prior to starting your research efforts, you will have taken and made a written document that describes things like the study background, your objectives, your hypotheses, and your methodology, how you're going to do the search, what's going to be included, what's going to be excluded. You generally have to register your systematic review protocol in Prospero, which is an international database. And the reason for doing that is twofold. One, to reduce duplicate efforts so that other researchers aren't trying to do the same exact review. And then also to increase transparency and enhance reproducibility of the work. Scoping reviews don't have to be registered, but they probably should be for the same reasons. And typically you would register them in a database like OSF, Open Source Forum. Systematic reviews tend to follow a more structured research questions, usually like the PICO format. So P for population, I for intervention, C for comparison, and O for outcomes, versus the scoping review that follows the population concept context structure for your research question. And you don't always have to have the population piece. So really concept and context are the focus. As I mentioned before, the systematic review is more narrow in scope, whereas the scoping review tends to be more broad. And as an example that illustrates these differences nicely, these are two titles of actual published reviews. So you can see for the systematic review, Effective Medical Scribes on Throughput, Revenue, and Patient and Provider Satisfaction, a systematic review and meta-analysis. So the population there is emergency department patients and providers. The intervention is scribes. The comparison is versus no scribes. And then the outcomes are throughput, revenue, patient provider satisfaction. Versus the example of the scoping review titled Race, Racism, and Anti-Racism in Emergency Medicine, a scoping review of the literature and a research agenda for the future. So this lacks that population piece of the PCC question, but you can see the concept is race, racism, and anti-racism, and the context is emergency medicine. Systematic review requires a mandatory critical appraisal of the literature that's included, and that's usually through a process of assessment of risk of bias. Scoping review doesn't require that, it's optional, but it does strengthen the robustness of the findings. So there's 3 questions you should ask yourself if you're deciding between these two methodologies. As you kind of do a preliminary search, are you finding that when you look at your research question that the study designs vary? Maybe some are more quantitative in nature, maybe some are qualitative. Are you recognizing that you're investigating an emerging, a complex, a large, or a heterogeneous field? And is your goal to characterize, organize, or map? If yes, it's probably for you. And with that, I'll hand it over to Mike.
I got the mic. I'll take that one out. All right, so we've established now, what do we use a scoping review for? We have a sense of the types of questions we might ask. And that is always a really good starting point, is what's the right model for that? So now let's say, all right, we decided scoping review is the right fit. Now what? How do we operationalize this? And more specifically, how do we operationalize this and get published? I can do this, I can do the work, but I want to make sure it's a way that's high enough quality gets published. Now, fortunately, there's an easy 6-step guide that's been published over and over again. Arksy and O'Malley did it, LeVac did it, there's a PRISMA guideline. What we did is we tried to condense that into about a 9-minute summary. That's how much you need to know. 9-minute summary, and then follow the guidelines. So it follows 6 steps. Identify the research question, identify the relevant studies, select the studies, chart the data, collate, summarize, report it, and then consult with stakeholders. So let's break it out. Step 1, you want to identify what the research question is. What's the rationale? What are you seeking to understand? What's the global question? And then what are the sub-questions? As an example, we did one looking at EVUs, education value units. The overarching question is, well, what exactly is an EVU and how do I use it? We have to get more specific in there. How do you develop one? What are the stakeholders to develop this out? How do you implement it? What are the outcomes? What are the barriers? Right? Those aren't discrete PICO questions. Those are more hazy. Perfect for a scoping review. So we say, all right, we've got our kind of rationale, we've got our research question, we've developed those kind of sub-objectives, and then the thing that everyone forgets is that pilot search. What the pilot search does is, it tells you, is this the right fit? If I'm doing a study of EVUs and it turns out there's only been one study ever published on it, well, I'm not really going to scope out much. There's not a lot to match. Right? I'm going to try and map this literature, and I'm going to say I found one study. No one's interested. But what if instead there's 3,000 studies on EBUs? Well, I could do that, but I'm going to spend the next 5 years of my career doing a pseudo PhD trying to be a master of EBUs, and it's not a feasible model. So you want the sweet spot. Enough that you can do it, but not so few that it's just not useful to anyone. You want to pilot it, see what you find, make sure it's going to actually be able to answer your question feasibly. All right, step 2, identify the studies. You want a research librarian. They're your friend. They are amazing. They will help you find the terms that you may not have thought of. They'll make sure it's more rigorous. Identify your databases. Where are you going to search? What's relevant? There's a database called CINAHL. Stands for Cumulative Index in Nursing and Allied Health Literature. That's probably really useful if I want to look for interactions between interprofessional skills. It's entirely useless for EBUs. Pick your databases that match what you're looking for. You're going to pilot test this. You're going to pilot test your search like you just did before. Figure out what doesn't happen. And the way I pilot test, I'll run the search, the full one across, let's say PubMed. And I'll find at least an existing systematic review or a couple of key articles I'm aware of that I found during the first round that said, yeah, there's enough to look at this. And I say, did it capture it? And if it didn't, I say why, and we figure out what's the missing term. If you don't do that in the back end, you're going to find your missing studies. It's a very easy thing to do at the beginning. But if you do it later, you're going to regret that you have to try to go back and fix your search. And use software. So once you're going to pull the studies down there, yes, you can do it manually in PubMed or in Excel, but it's really painful. Use Covidence. Use RAN. Use there's free software. Covidence, if you make up an account, they'll let you do at least one for free. I guess I shouldn't say that on audio recording, but yes. Go ahead and take advantage of software. It makes your life so much easier. It's a lot quicker to go through. All right. So now you're going to select your studies. First thing is it's a little bit different than how you do systematic reviews. So for those who've done systematic reviews before, you have 2 people independently screening all the articles, and at the end they get together and they resolve discrepancies. That's not a scoping review. A scoping review is more iterative, it's more discussive. You get through a chunk of them and you talk and you say, you know what, I started going through this, I realized that we should adjust our questions. It does mean you sometimes have to go back, but at least it means that going forward, you're more focused on what you're trying to attain. So you do want to have those discussions. It's actually normal in scoping review, whereas it'd be very atypical in a systematic review. You want to make sure your criteria are clear and that they get defined as you go through it. So you identify what are your sub-questions and make sure that through each stage that you're actually capturing what, and it's pretty clear the kind of grouping of studies you're looking for. And it is rigorous. Anytime you're doing a systematic or scoping review, always 2 people. That is critical. That will be a fatal flaw if it's one person going through it. And it's a couple-fold. One is just in general, if you're scrolling through things, it's very easy to misclick and miss someone, right? So the other 2 people misclicking the same one, a lot higher. But also, we all carry our own inherent biases. And it's like we may not think is relevant. The other person may say, you know what, that's actually incredibly relevant. And so being conscious of that piece too. We're doing a scoping review right now in holistic review. Turns out it's a really hazy term. That's the reason scoping review is perfect for it. And as we're going through these studies and looking at it, when you start to delineate, you're like, oh, is that really holistic review? Is it not? You need multiple lenses onto this construct to say, yeah, I think this is worth including forward, and this one isn't. So you want those lenses into it. All right, so now you've got your studies. You selected your 20 or so studies that were relevant for this. You're going to chart your data. And charting your data comes in 3 flavors. Well, first you're going to develop your extraction form, make sure you know what you're extracting. And it's iterative again. What you'll find is when you start piloting it out, you're going to adjust some of these fields. Some of these fields will make more and less sense as you go through them. You may find the things that made sense once you extract the data, you're like, wow, that was really vague, and that's going to be painful on the back end to try to correct. So you're going to have those discussions again to iterate your form, to iterate what you're collecting, and maybe you add a new question as you go through that. You want to make sure you're consistent across the field that you're kind of talking about this. And as you're going through it, you're going to start to collect and kind of organize your themes. And your themes are often align with those questions you laid out. So in the context of, again, EBUs, maybe a theme there is development. And I have a series of pieces on that. Maybe a theme of this coming across here would be the implementation of it. Maybe a theme is outcomes. And I might subdivide those into my categories, but make sure they're aligning with your question. All right, so now you went ahead and you actually extracted all this data. You have this big Excel sheet with a ton of data, and then you have 3 things you do. Step 1, you're going to do descriptive. I found X number of studies over X number of time. They were predominantly conducted in emergency medicine, internal medicine, and the majority of them were descriptive in nature, and a couple had outcomes. Descriptive, kind of global, kind of like if you imagine a systematic review, that's like your first paragraph. Then you want to go ahead and you start kind of reporting the trends. So what I noticed across these studies, we would start to answer our questions. How are they created? The majority were created by consensus model. 20% of them were developed entirely by the chair with his scattered input, and three were created just by a dean. Right? You start to identify, these are themes, right? These aren't just pure scripted, they start to identify themes of how things are created, how they address your questions. And then you start to add context to them. And that's really where discussion comes in, that last piece. You start to say, all right, now let me situate this. So from looking at this literature, it seems that a lot of them have to do with the idea of trying to create equity. And I could pull in equity literature. And what we see across these is a lot of these are trying to enact change, maybe a whole self-determination theory. And we're starting to situate this in what we understand. And then the last step is the one that people sometimes forget, stakeholders. That's because Arxio O'Malley said, yeah, it's optional, don't worry about it. And then Leveck came along and said, no, you should do it. Well, your stakeholders are anyone that's going to be impacted by this. Maybe if this is EVUs, in the context of that, I'm asking practicing physicians, I'm asking chairs or medical directors. If it's holistic review, I'm going to ask students, I'm going to ask residents, I'm going to ask diversity in education leader, diversity, equity, and inclusion leaders within the institution. If I'm trying to understand the role of something that's more healthcare oriented, I'm going to ask patients and nurses and allied healthcare. I want to try to understand all the stakeholders to make sure that A, I'm not missing articles, but B, they understand the broader context, I'm interpreting it correctly, and there's not something I'm missing. There's almost always something that your group will not think of. And those external stakeholders are how you make sure that you're putting something out that matters, that's thoughtful, that's reflective, and that is really kind of helping to push change. A lot of this will be identifying what we need to study next, but sometimes it is, here's what we learned, now what do we do with this? A couple limitations. Make sure it's the right question for the right method. If it is a very discrete question, systematic review is better. Again, if you're trying to do something broader, trying to map something out, you're going to want something more like scoping review. It is time-consuming, it takes work, and you do have to go back. And so you have to be kind of aware that it isn't as easy as it seems, but it is very, very, very doable. The third one, and probably the most important one, is you have lots of data. Be thoughtful about what you collect. If you collect things really broadly, you're going to have a really hard time with thematic analysis later. So when you're doing that data extraction, you look in the form, make sure you understand what you want to gather before you start extracting the data. It'll be much easier to then develop your thematic analyses. All right, with that was a summary. And what questions do you have?
Great talk, thank you. Tell me what your thoughts are on conference abstracts. Because sometimes they include more data, less data, especially when they might not include all of the factors that you're extracting, especially in methodology.
You go first.
I would think that would kind of count within, I don't know if you would technically count within gray literature, but when I've done these before, I've had included studies, even if they haven't necessarily aligned with every column in my chart. I'll just kind of put it in there. So I think if it answers your research question, I personally would include it.
Yeah, I think you're going to find answers either direction of it. As a general rule, if there's an abundance of studies, and it's not something so cutting edge that you think conference abstracts are going to add something massive in there, you're probably okay leaving it out if you don't want to. But you could very easily make an argument for adding it in. It's harder with systematic reviews because you can't do quality analysis on conference stuff. So systematic reviews, we tend not to do it unless it's something really cutting edge. But for scoping reviews, if it is cutting edge, wow, wouldn't it be a great miss to see something that's really evolving and not have access to that piece of information, especially if you're trying to scope out where the literature is. And because scoping reviews, it's controversial, but it's not required to do a quality analysis, you can really kind of report some of those areas. Ultimately, you're limited by what they put out, but I think you're probably safe either way. I base it on how evolving the literature is.
That sixth step about engaging the stakeholders, so is that something you're including in your methods at the end of the day? You're saying, after we got our results section, discussion section, we're going to draft it, we took it to XYZ groups for feedback.
Exactly.
Okay.
So my results section, or my methods section, mirrors step 1 through 6. It just follows down, it says exactly what I did. Step 6, I document who I talked to. If they want to be acknowledged by name, I put them as an acknowledgement. If they don't want to be acknowledged by name, I just summarize what their role and experience is, what they bring to the table. And I also put in there what our experience is. I'm approaching this, in the context of, for example, we did a study looking at bias and assessment. And so as we laid it out across our study team, I was like, I'm a white, cis male. That is my lens I bring to this. We have people across multiple races, ethnicities, sexual orientations, and genders, and they're coming into this, and we're each reporting kind of our lens, not labeling ourselves individually, but labeling as a group what we represent, so you can understand the lenses of what's being brought forth. And the same thing when you look at stakeholders, you want to have a broad representation of all relevant stakeholders so you can kind of understand who's looking at it. And then I'll usually put examples of what we've changed as a result of that. So again, in the EVU paper, which is published in Academic Medicine, so you're welcome to look at it as an example of what we did. We included both expanded discussion of diversity, equity, and inclusion, and we include self-determination theory, and we document how we changed our discussion based on the results. And they looked through the whole paper. They told us missing articles, they told us typos, and they told us what areas we felt could have been involved more. And that was incredibly valuable. And so I highly, highly encourage that step.
Oh, I think everything you said. Nothing further to add. Very helpful.
And you sort of down one pathway down, scoping review, and realize halfway through this is better suited for systematic, vice versa, or
Most of the times that I've been doing this, it's been kind of a mix. We roll with somebody like my group shoved in, leading counsel, best guidance, and medical education. So I haven't entered it that early on in the phase, but I imagine, Mike, that you would have had experience switching gears and share your perspective.
Yeah, it's tough. I've definitely had that, and that's often at that pilot stage. So I've come in with an idea, it's going to be a scoping review. We're like already starting to register it, and then we do the pilot search, and we're like, wow, this data is, either really similar, enough so that it actually answers a systematic review question, which scoping review isn't a great fit, or there's so many and they align better there. But I've also had it where I started off with what I thought was going to be a clear systematic review, and then we start the search and we realize that there's so much heterogeneity, there's so much differences across the design, the outcomes. I was like, there's no way we can combine this together. In which case you have to decide then, is it a systematic review without meta-analysis, so you're just going to describe everything, that's totally valid, or are you going to broaden out and try to map it out and try to contextualize it as more of like here's how they fit together like pieces, and and more times than not ends up fitting in the latter category. But you do have options based on that. It just depends on what you find in your pilot.
And I think this brings up a good point, is that usually if you're starting out with this sort of, you should do it for the like Mike has been in the work one of these that I did. I would have really struggled starting this out on my own, and it's really helpful to have somebody who's had some experience doing this, because the steps sound simple, but when you're actually like getting into the weeds with them, it's nice to have somebody who's encountered the issues before and knows how to anticipate pitfalls and things like that.
100%. The very first event you study as a design I do, I always seek out mentors. Always, always, always.
Any other questions?
All right, thanks all.
Anybody?